Good evening, everybody. I'm Sayukta, your host for today's live from All About Skin Allergy team. I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would have encountered at some time in their lives. Urticaria is characterized by round rash on the skin that itch a lot. It may be due to chemicals in certain foods, allergy to certain medications, insect stings, sunlight, and sometimes the causes unknown. As per study published in Indian Journal of Dermatology, Venereology, and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidences are higher in older age groups. Urticaria is classified as acute and chronic, but the most important part is not to ignore it, and doing self-medication can actually worsen the symptoms. Consult your nearby qualified skin specialist immediately for an early remission. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, kind of test required for its diagnosis, the right treatment and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us renowned dermatologist of India, Dr. Sushmitha DJ, live from Rainbow Healthcare, Mysore, Karnataka, talking about urticaria and its management. Dr. Sushmita is MBBS MD Dermatology. She has huge experience in the field of dermatology. A very good evening to you, Dr. Sushmita. Hope you're doing good now.
I'm good. Thank you so much.
Doctor, as today we are going to talk about urticaria and its management. First of all, we would like to understand what is urticaria.
Okay, urticaria is a skin condition which is characterized by extremely itchy, also called as pruritic, reddish, raised bumps or rashes on your skin. It can occur anywhere on your body. Okay, it can occur on your scalp, it can occur inside your mouth, palms, soles. Okay, it can start as a tiny small rash and it can become confluent and can spread to almost the entire body.
Right. So this is what urticaria is. And what are the main causes responsible for urticaria, doctor?
The causes for urticaria are innumerable. Everything under the sun can cause. Okay, there are like anything you name is capable of causing. But in 50% of the cases, we are not able to understand why it is happening. We call it idiopathic. We do not know the reason. And another 40% it could be because of infections, mainly because of your upper respiratory tract infections, because of your gut infections. Another 5% could be because of food. Another 5% could be because of your medicines or drugs.
Right. So as you said, anything under the sun or even the sun can cause urticaria. So there can be a number of, causes responsible for urticaria. Doctor, you've already told us how does it look when you were trying to tell us what is urticaria. But again, because normally, we do have a lot of skin infections or skin allergies, I should say. And maybe at times it can be, difficult for a person, for a layman to understand whether whatever is happening on his skin is urticaria or some other kind of skin allergy. So can you please again a little bit elaborate on how does urticaria look like?
It can start suddenly anytime. Anytime it can start, and usually starts as a tiny reddish raised bump. Like example, any insect bite reactions, like it could be a mosquito bites, like raised elevated bumps on your skin, and it's usually extremely red, extremely itchy. Okay, and sometimes it can be associated with even swelling of your face, mainly around the eyes, swelling of your lips, difficulty in breathing. That is if it is associated with angioedema. But per se, urticaria can happen anywhere. So mainly they are elevated raised bumps on your skin. Right. And they usually resolve within few minutes or hours, sometimes less than 24 hours. Sometimes it tends to stay more than 48 hours.
Right. So, right. So now we understand how does an urticaria looks like. Doctor, we would also like to understand how serious this urticaria can be, or is urticaria a serious disease?
Urticaria is not a disease per se. It is just a reactive process of our skin to several other etiologies. We cannot call it a disease per se. It could be just a reactive process of the skin to several allergens in the environment or various infections or drugs. Yeah, right. But usually 70% of the cases, it comes and goes. Like when you get the lesions, by the time the older ones resolve, the newer ones will start appearing. Okay. But in cases where it can be associated with angioedema, like I said, angioedema is nothing but swelling of the deeper layers of your skin. That is the deeper dermis, your subcutaneous tissue, the fat tissue, and the submucosal tissue. That time you can call it serious because it can cause laryngospasm. It can cause difficulty in breathing. That time is you have to step in and see a doc immediately.
Right. Before we move forward, doctor, if you can just, make some distance between your screen and yourself, because otherwise, we are getting a chopped frame. Yeah, I think this is much better. Yes. Now we can, talk further about urticaria. We would also like to understand, like in the beginning, I said that there are two types of urticaria, or we can actually categorize it in two types, acute or chronic. Can you shed some more light on, when an urticaria is chronic, when it becomes, when it's acute, when it becomes chronic?
Urticaria can be mainly classified. One is, like you said, depending on the duration. If it is occurring less than 6 weeks of duration, we call it acute urticaria. Okay. And the lesions will usually resolve within few minutes to half an hour or 1 hour. Okay. And acute urticaria is most commonly seen in the pediatric age group or the younger adolescent age group. And chronic urticaria, if it's occurring every day on a daily basis, and if the lesions and your symptoms last for more than 6 weeks, that we term it as chronic urticaria.
Okay.
And chronic urticaria is mostly seen in middle-aged people, whereas acute is usually seen in the pediatric age group as well as the younger adolescents.
Okay. And if we talk about chronic urticaria, can it be cured completely? Does it goes away permanently?
No, we cannot say it can be cured completely because we don't know what is causing it most of the times.
Okay.
So first thing you have to counsel the patient is you will have to know what is triggering it, and avoidance of the trigger could help the patient, or the patient could benefit from it. But there are a lot of studies with a lot of newer treatments who are doing a lot of research. They say I read a study like from IGDVL from 2017. So around 60% of the patients had no symptoms in the next 6 months with treatment, but there can always be recurrence. Patients can come back anytime if you're exposed to the trigger again.
Right, fair enough. Doctor, we would also like to understand what are the potential complications of urticaria if left untreated.
Complications as such, like I said, yeah, you can go into anaphylaxis. Anaphylaxis is an acute generalized reaction where there is a lot of malaise, you have fatigue, you have low mood, and you can have difficulty in breathing, you can have fall in your BP, hypertension. Okay, then you can go into angioedema. Angioedema, like I said, it is most of the time, like 30% of the patients with acute urticaria can be associated with angioedema. Angioedema is nothing but deeper swelling of your skin, where your deeper dermis, subcutaneous tissue, and submucosal tissue is involved, and it is mostly painful rather than itchy compared to acute urticaria. These are some of the things which can occur if you leave it untreated.
Right. So by what you said, doctor, I can make out that it's a very frustrating, for the patient who's suffering from urticaria or have this condition, because he or she is continuously itching. Now, the thing is, it definitely causes a lot of stress. Now, can that stress again exaggerate your condition or aggravate urticaria?
Definitely, stress itself is listed as one of the causes in chronic urticaria.
Okay.
So in more stressful events, definitely, you know that, you are in a situation like it can exacerbate.
Definitely. And especially because, many times I've seen patients or heard them saying that, I don't want to go to public places or to any public functions or socialize because I don't want an embarrassing situation where I'm continuously itching myself. So people, who have this condition start aloofing themselves or stop socializing, and definitely it creates a lot of stress, many other complications, and their mental health also needs to be counseled. So whenever a patient with urticaria or chronic urticaria comes to you, is mental counseling also part of the treatment?
Definitely, counseling actually forms 50% of the treatment in urticaria patients. Okay, you will have to tell them what could be the triggers, what they should avoid, especially like I said, food can also cause urticaria anytime. Like you said, if they go out, if they go out to a restaurant, public places, and they should always carry the medicines with them, like probably a strip or few tablets with them, since urticaria medicines are quite small. So they can pop in any time. And these antihistamines will reduce the urticaria lesions like within half an hour. They will get some relief, and definitely you need to counsel them that it is not a contagious disease. It is not going to spread to anyone. So right. With the medicines, they will be fine. And they should just avoid the trigger factor, whatever could be the trigger. Try to avoid the trigger.
So the bottom line is it's important to understand what's triggering urticaria and to try to avoid what's triggering it. Many times, doctor, it happens because you've already said that it may cause from n number of things. One definitely is food allergies or allergies to medicines or other various things. Now, the thing is that many a times people do understand they are allergic to certain food items, like, for example, say egg or sea food or cheese or nuts, etc. So they can actually avoid those things that they are allergic to. But many times people who are not allergic to anything or who don't have even a history of urticaria will still start avoiding these things or these umbrella lists for the sake of never getting urticaria. Does it help?
That is called pseudo allergy. They think anything they eat can cause them the lesions or urticarial lesions. Okay, but what studies say is like less than 5% of the foods what you eat can cause urticaria. But yeah, since if you are suffering from severe urticarial lesions, we always advise them to be on a diet which is low on histamine.
Okay.
And but the list otherwise they don't have to avoid. If they eat it and it's causing them, they can avoid. Otherwise, they can always do a re-challenge test.
Right.
They can eat it and see if the lesions are coming instead of simply avoiding them. Everything cannot cause, all the food items cannot cause, but there are a big list of food items which are rich in histamine, which can trigger the lesions.
I think the most important thing is to go and consult a doctor, consult an expert, because only a doctor will be able to, advise the patient perfectly that what he should include, what he or she should, avoid, etc. So just by avoiding on your own everything from your plate can actually make you malnourished. So don't do that. Instead, go to a doctor. That's more important. And don't just wait and say that it will go away on my, on its own. And I do have these things, so I am allergic, so I'm bound to have this. No, you don't. There are medicines, there is a treatment available. So please go and consult your doctor. That's more important. And consult them as soon as possible so that the length of treatment can be they can keep a check on that.
Yeah,
so please go and consult a doctor. That's more important. And doctor, again, because you have also said people are aware of anti-allergens or anti-allergic medicines, and they know that, okay, if I'm getting some allergies or, these raised bumps on my skin is because of those allergies, they will just go buy something over the counter and start having it and keep on having it whenever it occurs. So is that a safe practice?
See, mainly in urticaria, you should know what dosage of medicines you should be taking. Every drug comes with its own side effects.
Right.
We do not say any drug is safe and for the patient to take over the counter. You can be overdosing it also, and you can be like the patient could be abusing the drug, and the patient might not be taking the required dosage, might not be getting results also from that. So basically, to get the right benefit, it's better to visit a dermatologist or a physician.
Exactly. Like, many a times what happens, anti-allergic can make you, because they also work as sedatives,
Yeah.
So sedation can be
A
one.
lot of drowsiness is there.
Yes, yes. And suppose your profession is of driving or, anything which involves very sharp attention and focus, and you have just popped in a anti-allergic and, dizziness, etc. is happening to you, you can actually land up in a really bad situation. So to avoid all this, please go and consult your doctor. That's more important. The doctor will advise you what to take, what not to take, which medicine to take, etc. So our, most important focus is on going and visiting a doctor whenever we have an issue.
Because patients themselves do not know what is the sedating antihistamine, what is the non-sedating antihistamine. At that point of time, they are so frustrated over the counter, they will just get anything which will give them cure, and they will take it.
Right. And many times with the chronic urticaria, again, I believe, because again, the treatment, may take a lot of time, especially because the trigger or the cause is not known. In that case, again, as a patient, people do feel frustrated and they stop by themselves taking medicine, and again will start the medicine without even consulting the doctor. So I'm sure you must have also come through such patients. What is the right way to actually, continue the medication?
See, when you're treating a chronic urticaria patients, you should try to find out as much as possible what is causing it, okay? And whatever the minimal, and there are an array of investigations which you can do to see what could be causing it. One, like I said, chronic urticaria, like idiopathic, 50% we do not know. Rest, you can look for autoimmune conditions. Now, newer studies say autoimmune conditions, autoimmunity can also cause chronic urticaria. Like if you are suffering from any autoimmune thyroid disorders, then if you're having rheumatological disorders, and you can also get yourself tested if you're suffering from any underlying parasitic infections in your gut for a long time. All these assays can be done.
Okay. Doctor, many times patients complain that their urticaria get worse during night. Why that's so?
See, urticaria, the itching is mainly a vicious cycle, okay? In their sleep, what they tend to do is if one lesion appears also, they tend to scratch it, okay? The more you scratch, more amount of histamine will be released. It is called as the itch-scratch cycle. Okay, so mainly the cells which are mainly affected in urticaria are called as the mast cells. Mast cells contain a lot of pro-inflammatory mediators. Pro-inflammatory mediators in normal terms are the substances which can cause irritation to your skin, like histamine, serotonin, prostaglandins, leukotrienes. What they do is they will be immediately released and they will act on your blood vessels, and there will be hives immediately. I don't want to go deeper into the pathophysiology.
Right. And also because, during the daytime, we are so preoccupied. So we have all the time to keep itching our, those raised bumps, and that may, as you said, can actually
the cycle just goes on. You just keep scratching. You feel like scratching more. It's called as the itch scratch cycle.
Right. And many times patients also complain that they feel very fatigued or tired. So is that again, what comes with urticaria?
Usually, if you're suffering from acute urticaria, these symptoms are usually not there. But yeah, if you are suffering from angioedema along with urticaria, these systemic symptoms, and there are a lot of conditions which can masquerade like urticaria. I mean, which mimic urticaria, but it is not exactly urticaria. In such cases, like you said, all these systemic symptoms, like they feel very fatigued, they feel very tired, very low mood, all that is there. In such conditions with masquerade urticaria, these symptoms can be there, like urticarial vasculitis, which mainly affect your blood vessels. there are a lot of other conditions, like there are a lot of syndromes, like Muckle-Wells syndromes is there, Schizner syndrome is there. So in these conditions, you're more prone to getting systemic symptoms.
Okay. Is there any dietary precautions or do's and don'ts for the patients of urticaria?
Yeah, definitely. First, we will take a proper history, elicit a proper history from them. Okay. And if they're allergic to dust, which is called as atopic, that is one of the main causes. And if they have a lot of carpets, sofas at home, we ask them to dry clean, we ask them to dust them regularly. Okay. And as dietary restrictions as such, we always ask them to keep their diet low, like take foods which is low in histamine, okay, and avoid foods which can trigger, like mainly yeast, fermented foods, fast foods, canned food items, mainly because all these contain a lot of coloring agents, preservatives like salicylates, citric acid, benzoic acid. All these are preservatives which are present in the food, and it can trigger urticaria. And coming to fruits and vegetables, almost I would like to say most vegetables are safe, but I would like to mention a few like tomatoes, spinach, brinjal. They tend to have a little high histamine content, and you can avoid them. Like nuts, then berries, you can avoid them. Then cheese and eggs, and even crustaceans, seafood, that can also aggravate. And so if you're going to a restaurant and you know you're already allergic, so you better tell your chef, please avoid these. I don't want mushrooms. I don't want fish. I don't want egg in my food.
Right.
So you're already like preventing it from happening.
Right. So as we also discussed before, that if you know what you're allergic to, try to avoid that situation, and of course go and consult your doctor. That's really important. Then there is one category, doctor, where people are, were not allergic to anything till the point, and then suddenly they start having urticaria, etc., and they'll just go through and understand that actually whenever they are eating egg or anything, they are having this problem. So is there a way to keep a track or maintaining a diary, etc., for people who are having it for the first time and understand what's triggering it?
Yeah, definitely. We ask them to maintain a food diary.
Okay.
Okay. Like what are they taking in their diet? Are they eating foods from the outside? Are they taking anything new in their diet?
Mm-hmm.
Okay. So when they do that, at least you have an idea. Anything new has been added to the diet, so you can ask them to avoid such things.
Okay, right. Especially during the last 2.5 years, what we call the COVID era, many people complain that they have, hives on their face after they were tested positive for COVID, etc. So can COVID cause hives?
Definitely, definitely.
Okay. And how bad that can be? I mean, is it treatable? Is it acute?
Definitely, urticaria secondary to COVID is treatable. As COVID settles down, the urticaria lesions also settle down. But the skin manifestations of COVID are plenty. And urticaria is also one effect, okay? But not many people did report of urticaria. But yeah, taking antihistamines would help along with the other treatment of COVID.
Okay, we would now like to talk about the treatment options available for urticaria.
So coming to the treatment options, mainstay of treatment would be antihistamines. Like the word anti says against, okay? So mainly you want to prevent the release of histamine, which is the main causative factor in causing hives, okay? So coming to the antihistamines, there are two generations, okay? H1 receptor antagonist and the other one is H2 receptor antagonist, okay? So again, in H1 receptor antagonist, we have two types versus first generation and second generation. First generation antihistamines should be actually avoided in pediatric age group, okay? And first generation causes a lot of sedation and drowsiness because they say it can easily cross the blood-brain barrier. So the sedation levels will be high with first generation H1 antihistamines. For examples, it could be your the drugs which are easily available like chlorpheniramine, phenyramine, hydroxyl hydrochloride. Okay, so in the second one is second generation H1 antihistamines are much safer. Like you asked the other time, like if you have patients who have occupation of driving at night, we have to stay up in the night. So second generation is much safer than first generation, does not cross the blood-brain barrier, causes less drowsiness, much safer. Example, cetirizine, levocetirizine, loratadine, desloratadine, fexofenadine. These are the drugs which you can give. And usually start with dosage of like 10 mg once a day. But you can always updose it up to 4 times if the patient is still having lesions.
Right.
Okay, and yeah, antihistamines is one of the main treatment options. Along with that, you can also use leukotriene receptor antagonists like montelukast. Then you can use short bursts of steroid if the patient is having severe urticaria to bring down the inflammation immediately. Okay, and you can use corticosteroid injections, topical corticosteroids you can use. And nowadays, a lot of newer treatment options are available, especially for chronic urticarias. Like we have monoclonal antibodies, but they're quite expensive. Okay, monoclonal antibodies, like example, I would like to name a few, like omalizumab. What they do is they attach to the IgE in our blood and they prevent the IgE from attaching to other cells like the mast cells in our body and prevents the allergy.
Okay, yeah. So various treatment options are available. We would also like to understand that are there any live lab tests that you as a doctor, advise whenever a patient with urticarial condition comes to you?
Yeah, I would usually ask for a complete blood count with a differential count, and I'd ask for an ESR, like CRP levels. Then yeah, usually sometimes if it's extremely severe, I ask for a skin prick test. Skin prick test is where they inject several allergens and they elicit if you're allergic to it or not. Then you can get complement assays done. There are different.
Okay. And as you just mentioned, because nowadays labs tests, especially which tells about how many things you are allergic to, is very common and very famous with people. So people can actually go to any lab and do those tests and then come to the doctor saying that, see, I have done the test and I'm allergic to 30 items.
There are a few protocols before getting those tests done. You'll have to stop all your antihistamines 4 to 5 days prior to getting it tested. If you take the antihistamine just going for the test, you can get a false positive test result.
Okay, yeah. So it's important to follow the protocol, and for that, it's important to go and consult your doctor. Only a doctor can advise you what test you need to have, right? So there's no point in going to a lab.
You can't just walk into a lab and get a skin prick test, because that doctor will decide how severe the disease is, if the patient really needs a skin prick test or not.
Right. Again, there are people who try to do a lot of home remedies on urticaria. Nothing helps actually, but still, something to cool the, the effect or the inflammation, etc., like applying aloe vera and other stuffs on the skin. Is it okay to do so?
We basically advise them not to do any self-medications as such. Sometimes instead of doing better, it can do worse to the patients. Okay, so yeah, mainly topically, we actually just give them a calamine lotion, because calamine has astringent action. It settles down on the skin, evaporates, and it causes cooling. So the itching immediately reduces. So if you have a basic calamine lotion at home, you can always apply it to those lesions.
Right.
That will do.
Right. And as you said, anything can cause urticaria. So if a person is allergic to aloe vera, etc., and he is applying aloe vera, then there are
that itself can irritate the skin.
Exactly. So it's better not to do any home remedy. Go and consult your doctor whenever you see these bumps on your skin. We'll also take some of our viewers' questions, Doctor. Aarti Singh is here asking, what should be the focus of the physical exam for urticaria?
Okay, first thing, when the patient walks into your clinic, walks into your chamber, you will have to see if it is acute urticaria or if it is spontaneous urticaria, or is it physical urticarias. Physical urticarias, like I forgot to tell you, there is something called dermatographism. Dermatographism is like, example, when you just stroke the skin of a patient with a pen or anything, wherever you have stroked, they develop lesions.
Okay.
Okay, and you'll have to examine the patient. You'll have to do the dermatographism test and see dermatographism is there or not. Then you have to rule out angioedema if there is any swelling in the patient. Then ask if they're allergic to hot water, cold water, sun, if they got in the sun. You have to mainly rule out the physical urticaria causes, because physical urticarias are too many. Like I said, dermatographism, cholinergic urticaria. Cholinergic urticaria, like I said, by taking a hot bath or exercising can also induce cholinergic urticaria. Then aquagenic urticaria. Aquagenic urticaria, cold water or hot water can induce that. Cold urticaria, maybe you can test it by just placing an ice cube on the patient's arm. And if they develop rashes, you can wait for 5 minutes. All these tests you can do to rule out physical urticaria.
Okay, very well. Then we have Asha Thakur asking, how is physical urticaria characterized?
See, these are the physical urticarias, like I said. If you're allergic to the sun, as soon as you step out in the sun, they will develop rashes, itchiness, redness on the face. Okay. Then there's something called vibratory urticaria. Anything like vibratory devices, like some people doing more lawn mowers, they hold the machine for a long time. The vibration it causes, they can develop urticaria at that part. And some people wear tight socks, and the the stretchable band of the socks, at that place where the socks falls, they can develop urticaria there. So these are the physical urticaria. You'll have to ask the questions to the patients.
And by what you're saying, I can actually, understand that it's so common. I'm sure all of us must have at certain point of time experienced urticaria, but maybe the awareness is not so, or people are so, hesitant in going and consulting a doctor that they end up going to a chemist shop and go for some over-the-counter medication. So again, people, please go and consult your doctor in case you have urticaria and it's bothering you. Alok is here asking, ma'am, what are the possible precipitants of acute urticaria?
Like I said, 40 to 50% you do not know what it is. Then rest, it could be because of your food. Then your upper respiratory tract infections. Okay, then it could be your drugs. Drugs, mainly your antibiotics, like your beta-lactam antibiotics, and mainly your painkillers, like non-steroidal anti-inflammatory drugs. Then even penicillins can also cause. And your medicines for the heart, aspirin, they can also precipitate. And food items, like I already listed out, canned items, frozen items, foods which are fermented, fast food. Such things can definitely trigger.
Right. Maya Sharma is asking, exactly which skin condition of the urticaria do people experience?
Sorry, I didn't get you.
I think Maya is again trying to say, what are the skin symptoms associated with urticaria? Like, how does it look like? Maybe she joined us later, so she missed the part where you discussed how does it.
So yeah, they might experience severe redness, itching, extreme, like unretractable itching. You cannot stop it. Then raised bumps, like your mosquito bites. And by the time the older ones resolve, newer ones might arise in other places.
Right. And doctor, as we were discussing, that there are people who, despite going to the doctor, will go to the chemist and ask for an over-the-counter treatment and get relief, and that's how the story, begins and get forwarded. Now the thing is, there are again people who will consult their friends or family members who had gone through the same, itching or bumpy, rashes, etc. So, okay, you have that medicine, I'll also take that medicine. So they'll take their prescription, go buy the medicine and start self-medication. How bad self-medication can be, especially in the case of urticaria?
Yeah, we always advise our patients not to share their prescription with anyone, because you might not be suffering from the same disease what they are suffering. Everything red, everything itchy, everything bumpy might not be urticaria. Because there are a lot of other conditions which can mimic urticaria. So you could be misusing the prescription and you're bound to experience the side effects because of that.
Right.
So better go to your doc, get a consultation, know what is happening to your skin.
Exactly.
And then get a prescription, yeah.
And by, visiting a chemist and then doing self-medication or waiting that it will go away on its own, we are actually wasting so much of energy, money, health is also getting compromised. So it's always better to go and consult a doctor, an expert. It's really advisable. Shub is here asking, ma'am, can chronic urticaria affect the other body organs?
Chronic urticaria per se does not affect the body organs, but there is a condition which mimics urticaria. We call it cutaneous mastocytosis. Okay. That is a condition which is characterized by, like I said, mast cells are mainly the important cells which is involved in the pathogenesis. These mast cells can get collected in different parts of our body. It could be our skin, it could be our bone, it could be our gastrointestinal system. Okay. And these can cause later lesions. And how do you differentiate this cutaneous mastocytosis from this is that cutaneous mastocytosis usually causes lesions which are usually brown to orangish lesions.
Okay, right. And doctor, again, with chronic urticaria, because the treatment can be actually lengthy. Now, what happens that people or patients lose their patience and they stop the treatment by their own, or they'll, stop it immediately, and then they'll say that, okay, again, I'm getting the problem. Again, they'll go and take the same prescription and take the medicines, start having them. Again, they'll stop it after getting some relief, etc. Now, is it required, or is it important to complete the whole treatment?
If they are seeing good improvement with what medicines you have given, after a period of time, like initially when you start the treatment, you tell them to take the tablets every day, irrespective of they getting the lesions or not. Okay. And once they say, okay, doctor, I am recovering, I do not feel the lesions are coming back, you can slowly reduce the frequency of your medications. What you've told them to take every day, you can make it 2 days once. You can make it 3 days once. You can reduce the dosage frequency, and that way you can slowly taper the medications instead of just randomly stopping it.
Right. And before we wind up this session, doctor, any take-home advice for our viewers?
Yeah, definitely. Urticaria can get extremely irritating, and it can sometimes get very nasty, but make sure you act at the right time. Go to your doctor instead of just wasting time. Do not go to the pharmacist and ask, I have these lesions, just give me some medicines. Okay. But if you are like in a place where you're not able to get access to the doctor, at least you can take antihistamines like easily available. Other than that, I do not suggest you to take anything else. Best is consult your doctor and get yourself treated.
Right. So consult your doctor as soon as possible, whenever it's possible. Thank you so very much, Dr. Sushmitha, for your valuable time, ma'am. It has been a very informative session for our viewers, and I'm sure they will use this information to prevent themselves and their near and dear ones from getting urticaria. And in case if they get to see such symptoms, they now know that instead of self-medication, it's always better to approach a nearby dermatologist. It was great hearing you, and we really look forward for many more such sessions in the coming times for our viewers. Thank you so very much once again.
Thank you so much. Thank you so much.
And viewers, thank you for your participation in today's session. And to get latest updates on how to keep your skin healthy, do like and follow our FB page, all about skin allergy. We are also available on YouTube, Twitter, Instagram. Thank you. Have a great day ahead. Goodbye.